Hello, everybody. Happy New Year. Coming at you from Vein 911, Vein Treatment Centers, Tampa, Florida, live ultrasound-guided foam sclerotherapy session. What the heck is that? Foam sclerotherapy is basically the future of vein care available today. And unfortunately, it is not commonly performed, but it is the best vein treatment available anywhere in the world. Anyway, we have a lot of followers worldwide, physicians who are trying to improve what they're doing when it comes to foam. This is a patient you may be familiar with, very athletic physician. I'm not going to call him middle-aged, but he really has pretty advanced vein disease. He's a 4C classification. And those who might have tuned in before saw that I'm over on his right leg here, and we've previously treated him with foam. He's doing great. And he just has a mess of varicose veins in the ankle here, okay? Right posterior to the medial malleolus down here. And we have already closed that with foam. For the docs out there, there is no problem closing varicose veins in the ankle, foot, or even the toe if you need to. You can see his posterior tibial artery and paired veins. They collapse well. There's no blood clot in them. And we have completely closed those superficial veins. I am compressing, and they are non-compressible. They are dead. They are going away. They are carcasses on the Serengeti plain. And if you look really closely, Ava, come here so everybody can see you. I'm messing around, but those are carcasses on the Serengeti plain, and the birds, worms, and hyenas are going to take all that away. No surgery for this guy. Let's go on the other side, and he's got even more, okay? Bunch of varicose veins posterior to his ankle bone here, just a ton. And we can't leave him with that, okay? That's just, vein disease is leaking the attic, flood in the basement, and you don't want to leave a cesspool of blood down in this guy's ankles. He's not going to be fully treated. So myself, my ultrasound tech, have already looked at our handiwork. He's on foam session number 2. You never want to do foam once. Doing medical foam once is never enough. Never enough, just like one session of cosmetic sclerotherapy is never enough. So we've already been through here. We're just looking at some of our handiwork. We want to make sure that all these veins are completely non-compressible, and they are, which is why they're non-tender for the docs out there. If you leave veins partially treated, you've basically created a phlebitis, and they're going to hurt like crap. So anyway, you can see down here, there's some veins that are collapsing. They're kind of winking at you. Hello, hello. They're on death row. They're saying their prayers, and we're about to get rid of them. This is some residual GSV down low because it is connected to a lot of these varicose veins in the ankle. I'm going to go ahead and get rid of this here. Pinch. We do freehand technique here. There's no reason you can't use an ultrasound tech, but we like to aim the gun and shoot it at the same time. So my needle's in there, and this is 4th grade stuff. Simple video game. Foam looks like foam on the ultrasound. And you can see foam's getting in this vein here, no problem. Ava's not going to touch this needle because there's a 100% chance she doesn't get stuck if I don't give her that needle. So you can see that I injected, the GSV right above the ankle here. Actually, this is at the level of the ankle. We can see foam in the vein. We can see venospasm, which is a sine qua non of adequate foam. And lo and behold, there's no foam in this guy's tibial veins, okay? There's a little bit of foam getting through a perforator right here, but it's not a big deal. It's gone in 8 seconds. The foam isn't gone, but the biologic activity of the foam is gone in 8 seconds. So it's there's no need to be concerned about foam going anywhere after 8 seconds. Well, we're going to get right down into this ankle now, because we're not going to leave them with all this. The deeper straight veins are in his deep veins. If people are looking very closely, you can see the speed of blood flow in his tibial veins. I don't know if you can see the blood flow there. I put a little color on it. Maybe we can see, but he's got pretty fast blood flow in there, but he doesn't in the superficial veins. So even if I were to get some foam into these deep veins, it wouldn't matter. It's going to flush out, okay? It's just not a big deal. So I'm going to look a little more superficial so I can see this target better. And this is just a bunch of snakes kind of coiled up in a cave, hanging out in the winter. And we're going to kind of rough them up a bit. Little pinch here. So we are right behind the medial malleolus here. And we should be able to see my needle coming into view here quite shortly. Here it is. There it is right there. I have bent this needle. This is not something you want to do as a beginner. I'm making sure I'm in there. I'm definitely in there. So we can see my needle tip in there. I'm going to inject the foam. I am not going to be shy about it. I am not going to worry about this getting into the deep system. How much foam did you give me, Ava? What was our volume?
2.5.
Okay. So you give me 2.5 cc's of foam. That's a fair amount of foam. There is still nothing significant in this man's deep venous system because I'm looking. And I'm able to look because I'm holding the ultrasound. I'm holding the gun and I'm shooting it. So again, there's nothing wrong with having a helper to do it, but you're going to be a far better foam sclerotherapist if you do your own ultrasound. I put a whopping 2.5 cc's of foam in this patient's superficial system behind the ankle, and there is nothing or virtually nothing in his deep system. Those are his paired tibial veins down here. Okay, everybody see that? Okay, because a lot of docs have never even given them an opportunity to do something like that. We see a few tiny little bubbles. This foam is staying in the superficial system. Even for whatever reason, if it did get in the deep system, it would be washed out so quickly as to not create, it would not create any venospasm. So we just got an excellent result here. Again, this was 2.5 cc's of foam, and it's all remained in the superficial system. Maybe a tad bit of foam in one of those perineal veins, but it's not enough to do anything. And by now, it's been deactivated for sure. He still has fairly large, I can see it on the surface of the skin here. I'm probably going to leave this for right now. Go ahead and straighten this leg out and just see what else is going on. So we don't want to make these videos too long. We want them long enough so people can learn something, but not too long. We're just seeing if he has any other veins that we think are worth getting. He's got blue-purple spider veins right into his feet, foot, hind foot, forefoot, everywhere. So he's just got a bad genetic hit. He's in amazing shape, or this would have taken him down a long time ago because exercise is good for mind, body, spirit, and veins. I'm going to swing around here. But we're really going to help him here. So we can see a superficial vein there, pinch. You'll be able to see my needle coming into view. Our needle is in that vein. I'm going to inject again. This vein might be 2.5, 3 millimeters. It's kind of anterolateral, just above the ankle area. I'm injecting. Really not too concerned about deep stuff. I'm looking up here, and we can see the foam. It looks like white snow. We've gotten excellent venospasm, which is, again, the sine qua non for all those Latin people out there. That means it's the definition of adequate foam is that that vein has to squeeze down and go from a black pipe to a white line. If you haven't achieved that, you've not done what you need to do. So this looks great. How's our patient doing up there? Great. He's doing fantastic. One of the secrets to not hurting people is you need to snap that needle through the dermis as quickly as possible, and you're not going to get a lot of discomfort. I don't think you should use anesthesia or local anesthesia or anything like that. It's really not practical. Anyways, I'm looking over this area. I think I might just enhance this a bit. Go ahead and bend that knee just a little bit. I'm getting a hairy eyeball from my staff, it looks like. Because I have a few more cases. So again, I am right anterior to the Achilles. This is kind of the, and he needs this. He's got a bunch of varicose veins down the ankle here, blue-purple spider veins. Frank, Lebectatica. So I'm going to get this lateral branch, this small saphenous. Pinch. Okay. Going to be pinchy. Going to bend my needle here. Do not try this at home, although it is completely teachable and not hard for your vein physician to do. Let's see, we're getting in there. Hang on. All right. Let's see here. I think I might be right on the edge of that vein. You can see it's going into a little bit of spasm as I'm doing this. Just going to make it a little more challenging. Yeah, so now I had a tiny bit of extra, but I'm actually in now, and I'm injecting, and it looks good. I go back over this tiny bit of extra, but we got what we wanted to get. What we're going to try to do here, we're going to really see what Miss Ava's able to do, because I was going to help him with some of these spider veins. We're going to try to get the camera in here real quick, and if you want to work on that, I can generate the foam.
Just take the whole thing.
Yeah, I think I need to take the whole thing. So close your eyes, everybody. You're going to get very dizzy. Yeah, this is the Vein 911 studios. We'll get a lot fancier here in the near future. Watch this where we're going to jet here. Here we go. Hang on, you want to watch where that camera's facing there. Here, let me help you.
Yeah. These things are not making it.
Here, just do that. Go. But on top. Here we go. Here we go. We got to go through the pain. Okay. Woo! Are you going to be able to do this? Wait a minute. Let's do this. Intermission, everybody. Okay. Are we good? Man, that looks good. You can get even closer. Look at that. HD stuff. All right, here we go. Without further ado. So we're using 1% polydocanol foam, 1 for room air dilution. We are now using 0.25% polydocanol foam, 1 to 4 air dilution. And we also are now, we were using a 25 gauge needle. Right now we're going to use a 32 gauge needle, which is rarely used in visual sclerotherapy by other vein outfits. It is about the size of a hair shaft. It hurts a lot less, and it's perfectly fine, in my opinion, for both liquid and foam sclerotherapy. But the answer to everything in our office is foam sclerotherapy. If you don't get foam sclerotherapy, you can't be completely treated. Period. Check, end of story. If you're a vein patient and you can treat more veins, less needle sticks, more effectively with foam. 15 years ago, we were kind of laughed. Well, we weren't laughed at. We were just called rogue and maybe even dangerous. And I think now the best vein centers in the world are using foam. So we've been using foam a very long time. Here we go. So you can see a lot of these kind of videos on YouTube, Facebook. It's fun, it's satisfying because you get a preview of coming attractions. So we injected that vein. It's coming back fairly quickly, and kind of red. It's a little bit different. Now, he's got some really, big feeders underneath there. So these are going to be stubborn, and we expect them to go away. If they don't go away in 2 sessions, then 100% of the time, if your spider veins aren't going away after 2 sessions, 100% of the time, there's going to be a leak underneath or a root, a tap root going to that spider vein that you need to get rid of. You're going to need to go after it with ultrasound and foam like you saw me doing earlier. And if you don't do that, you're never going to get rid of that spider vein. And that's why we'll just talk about the ladies. A lot of ladies go out and get their spider veins done and they don't go away. They give up and they wear pants the rest of their lives. I don't care who it is. We can get rid of your spider veins if they're approached the right way. And you make sure you take care of the tap roots. Let's come in right in there. We'll do a few more here. And then I think we'll call it a day. And what do you say we call it a year, Ava?
Sounds good to me. Almost done with the year.
How you doing? Arms aren't hurting, are they?
No.
All right. How's our patient doing?
Good.
All right, excellent. We are polishing up this good-looking guy's ankle here. He's going to be ready to compete with the spring breakers by April. There we go. So it's fun. It's like an Etch-a-Sketch, if anybody remembers that. I'm old. So you inject this thing, it goes away for a moment. That's what we call a preview of coming attractions. Gosh, does that look good? That's one heck of a preview of coming attractions. Okay, as crappy as it might turn out, I'll say goodbye. What? Extreme close-up. Happy New Year, everybody.